I saw people coming in, and when I wake up, them in white sheet going out. One morning I wake up, and I just feel weak. And anyway, I go to work. I never take it as that, so I didn't have COVID, but I go to work. When I go to work, I just start sweat. I sweat more and what normal sweat is. When the time that I catch COVID, and I didn't know that I catch COVID, when I go to the hospital, when I come back, I know 2 persons who I talked to before I know that I have. When I come back, they passed away.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. Here in office with me today is Mr. David Clarke. Welcome to the show, all right? Yeah. We'll be discussing COVID-19, and Mr. Clarke is actually someone that actually had COVID-19 a few years ago and was actually hospitalized. So he will use this opportunity to just give an experience of what it was like to have severe COVID-19. So guys, remember to share, subscribe, like, and leave a comment on this video, and share with the persons that you may know that may have respiratory illness or have symptoms of COVID, because we still have a few cases here and there. So COVID-19 is a viral illness. It mainly have respiratory symptoms, and some patients may be asymptomatic. However, the cause of COVID-19 was coronavirus 2019, which is a virus that was first discovered in China, and the outbreak actually started in China and then ended up spread to the rest of the world, in which it caused a pandemic. Now, some of the symptoms of COVID-19, as I said before, some persons may be asymptomatic. However, some persons have respiratory symptoms which may be mild or severe. Some persons may have had a fever, a cough. Some persons have developed shortness of breath, and in more severe cases, some persons had end up with severe pneumonia and even end up losing their life because of this illness. Now, the means of transmission was mainly via airborne droplets, so like persons in close contact with each other would pass on the virus from one person to the next. It was also transmitted via contact, with some persons, if the virus was on objects that the person ended up touching, and then touching their nose, eyes, then they also could have contracted COVID via that means. Now, the diagnosis at the time was mainly done by PCR, all right? So that's a lab test that they test for the DNA of the COVID virus, and actually that test was initially expensive back initially, but they end up actually get it much cheaper and help improve the amount of persons being diagnosed. Now, the prevention was a next aspect of COVID-19 pandemic, which actually take a toll on the whole economic system of the world. Actually, it had lockdowns and quarantine and the previous social distances, etc. And it actually had minimized the spread of the virus, which could have actually caused the healthcare could have managed the amount of cases that we have. However, social distancing, washing hands, wearing face masks, isolation if you are sick, means in which we are used to prevent it. Now, the treatment for most patients were mainly symptomatic relief, because most persons that actually got COVID did not have any severe symptoms. But the unfortunate few who had severe symptoms would have required hospital admission. Some persons actually, the oxygen level in their blood went very low. Some persons have to get in oxygen. Some required what we call high flow nasal cannula rate of oxygen. And also some persons actually had to be admitted to ICU for ventilator support until they could be recovered. And this illness, it didn't discriminate, so whether you're poor, rich, working, not working, the elderly, they all actually had COVID-19. Some of the persons who actually had more severe form of the disease were actually persons that were elderly mainly, or persons which have other medical conditions such as diabetes, hypertension. Some persons that have cancer did poorly as well. Persons that were obese, especially obese females, has found out that those persons actually had worse symptoms for the COVID-19. However, as I said before, this is a podcast setting, and I want to just dive into basically the the whole story behind Mr. Clarke and how he actually managed the COVID here. So welcome once more to the show, Mr. Clarke. All right. So COVID-19 pandemic going on, lockdowns and everything. We're wearing face masks, hand washing. What are some of the symptoms that you were having initially when you had gone to the doctor?
Why am I going to the doctor? Anyway, I was one morning I wake up and I just feel weak. And anyway, I go to work. I never take it as that. So I didn't have COVID, but I go to work. When I go to work, I just start sweat. I sweat more and what normal sweat is.
Okay.
Yeah. So me start drink up some water. Me drink Pepsi, but it was more. So I leave work. I go home. I say no. I tell my wife, I say no, I don't feel well.
Okay.
So anyway, I was there. The next morning, I go to the doctor.
Okay.
The doctor said I'm tired, so I need some rest.
Rest, that was the response. Private doctor.
Private doctor.
Say need some rest.
Said I need some rest. I go back home. He give me an injection. He give me some pills.
Antibiotics? You got the antibiotics?
No, I didn't get the antibiotics. He give me some like pill if it keep me calm, rest and so forth. And I come back home. The following morning, I didn't feel so well. I got like a bad taste in my mouth. So when I get the tea and when I taste the tea, I don't taste anything.
Oh, so you lost your taste?
I lost all the taste. I said no,
well?
something well wrong, you know.
Okay.
And I tell my son, "So no, you got to bring me back to the doctor."
Yes.
And when I go back to the doctor, they send me to the hospital.
Okay.
Why he sent me back to the hospital? He didn't have any current at field office, so they sent me to the hospital. And when I go to the hospital, a nurse tests me. And when he tests me, it's like she don't feel any pulse.
No pulse?
No pulse.
Yes.
So I say, what's going on? She says she soon tell me she go off for a doctor. Then bring me to a screen. And they put me on a bed. Then say relax a bit. And then they do some tests.
Okay.
And the doctor say you're fully COVID. And from there, so they said they're gonna send me to a hospital, private hospital, to do some X-ray.
Yes.
The following morning, when I wake up, they say they're not worried again. They say cancel that. Don't do the test. The doctor said gonna send me to KPH.
KPH, okay.
Right.
So at this point, I just want to know the symptoms. Apart from feeling weak and you lost a sense of taste, were you coughing? Did you have a fever?
I didn't have a fever. I didn't coughing. No.
No shortness of breath?
Yes.
Or a short of breath?
Short of breath a little bit, but not much.
So why they had sent you to Kingston is that your oxygen level was low?
Yes, very low.
Okay.
And why they sent me to Kingston, they said the oxygen at Savlama was weak.
Weak, okay.
The one at Kingston gave me help. So I succumbed, they sent me to Kingston.
The oxygen level was low.
Yeah.
Alright, so at this point, what was, how did you feel at this point when you said they have to send you to Kingston? And
I couldn't walk.
you were that weak?
Yeah, weak, bad.
Weak. Unable to walk?
Follow that day, I couldn't walk. I couldn't walk by myself. But at the same time, I don't feel like I cannot move my hands, but when I want to stand up, I cannot move.
Cannot move. All right. So I know normally the COVID would have more severe symptoms in older person or person with chronic illness. Did you have any chronic illness like hypertension, diabetes, asthma?
No diabetes, high blood pressure.
You had high blood pressure.
Yeah.
Okay. But you were taking a medication for high blood pressure.
Right. I was taking my medication for high blood pressure.
Okay. So the short tablets. So do you have any idea of like where you might have contracted the?
Yes.
Anyone that was sick?
It was a funeral. It was a funeral.
Funeral. So other persons were there coughing or sick?
Lot of people were
sick there.
Sick there.
Okay.
Yeah.
All right. Now tell us about the journey from South to Kingston. They had call an ambulance for you?
They call an ambulance. It's an ambulance bring me from South to Kingston. Right.
Okay. Alright, so tell us about the experience in Kingston, okay, of COVID and its isolation ward you would have gone, and so I know that you could not get any visit from any relatives because of isolation ward. How was that experience like initially at KPH?
Well, at the same time when I reached, I was thinking about that thing, thinking about it very much. Say, how am I gonna make it here?
Yes.
But at the same time, I'm not really fretting on the sickness. I'm just keep just normal, make myself feel normal and good.
Okay. And in terms of the hospital setting now, what type of medication did you get? Like, were you on oxygen?
Yes, I was on oxygen, and the oxygen, I was on oxygen for about 3 weeks.
3 weeks.
Before it changed. I was on oxygen before it changed. Until when it changed. And before the change, they did give me a prescription to get some other medication, and that did work pretty good. Okay, so what you can share with the viewers what some of the cost of these medication that you had to get? Yeah, the first medication what I get, that was about $300 and something thousand. $300 and something $1,000. Yeah. So you had to get outside, but that was not in the government system. No, all right. I have to get it outside. Good. And that was very expensive. Very expensive. Yeah. All right. So how did you cope with the fact that you could not get any family member to visit you? Well, at the same time, God was on my side, A friend of water, I was been known by yes. Yeah, by Jevon, When I lie down there, I was there and I hear a voice, and that voice coming to me, it was one of my good neighbor, and I couldn't even believe it, But when I shout and I really get a response, it changed a lot. It changed a lot. I changed a lot in that hospital that night. Okay. It's like I'm home. Alright. So now I know that you're on the COVID ward, and this is a ward which have high mortality. So a lot of persons died on isolation ward, because this is an isolation ward which is like all the patients are normally on oxygen. They have a low oxygen level. A lot of persons die. But what are you feeling like when you see other persons dying around you, like in the same cubicle, and you know that they have the same exact? Trust me, I was like the 3-4 days. Trust me, I was feeling so fear of myself to see people dying. I saw people coming in, and when I wake up, them in white sheet going out, they die, and people against me die. There's a lot of things going on. The four day, I was so scared, Okay. But I have to just hold my attention and know, sir. I mean that. Okay. So. At any point in time during the admission, you thought that you were gonna die? No. No. For even the day when I leave in Salama in the ambulance, I raise up myself in the ambulance and I call my wife and say, "Don't worry, I'm gonna be back. Trust me." Okay. I wanna be positive. Confident in myself. I didn't give up. None at all. Okay, so while in the hospital, you were admitted for 3 weeks on oxygen. But how were you feeling overall? Did you feel like you were getting better or getting worse anytime in the hospital? I never feel like I'm getting any worse. I just feel like I'm getting better. But at the same time, I didn't even know that my body was getting down, like drying, until when I revived back in that hospital before I go to the other one. Alright. So some of the medication that we normally give patients in severe COVID case like is to give them like high dose steroid, which normally have some complication, like it will give some side effects like letting the person end up with diabetes. You had such case issues? Yes, when I come back home, when I leave the last hospital, and when I could reach back home, yes, about 3 to 4, about a week, I was feeling so dry in my throat till I told them that to bring me to the doctor, and they bring me to the doctor. When I go to the doctor, they say my sugar level is high. Okay. And he asked me what was going on in following that time. I said I was drinking a lot of sweetness, and he said, "Oh, I think is it." Okay. And from that, when him treat it, everything just go back normal.
Okay.
I really don't travel with the diabetes anymore.
Okay. All right, that's good. Now, when you were in hospital, you said that you were unable to walk initially. So, at what point did you regain your strength?
When I leave KPH and go back to the other hospital,
Yes.
but when the oxygen changed, they took me from there and put me to the other hospital. And following time about 5 to 6 days, I got my strength back.
Okay. Alright, so in terms of your experience while admitted on the isolation ward, what was the overall experience like for you in terms of interaction with the nurses, janitors, porters, doctors?
It was so good and good behaving.
Okay.
That was so good.
Oh, so at no point they didn't like feel scared or scared or anything?
No, Charlie. They was so good. Even the one that they look about the bed and whatever. Nice people, trust me.
Alright.
Yeah.
And so in terms of like before you got the COVID, like were you taking like the necessary precautions in terms of wearing face masks, social distancing?
Right, I was doing that. I was wearing masks. Like when I leave out, when I go in crowds or what's I put on my mask.
Yes. Alright, so in terms of the community now, do you know of other persons that actually had COVID and passed?
Yeah, and die too.
And die?
Yeah. For before when we get COVID, when the time that I catch COVID, and I didn't know that I catch COVID, when I go to the hospital, when I come back, I know 2 persons who I talked to before I know that I have. When I come back, they passed away.
Okay. Sorry to hear, but it was really a deadly illness. So what would you say about persons that think the COVID-19 still did not exist? It was just a means that government used to disrupt the economy?
Well, it's just like they say it's a disease, and it come from. They say come from animal, they say come from China, but how it reached in Jamaica, I didn't know. And it's so scary. And after a while, we never really know that's so dangerous.
Okay.
No. Until it start happening. People start pass away.
Alright, and these were some persons, even young, healthy persons. That was not just older persons that were there. Actually, some young persons actually contracted COVID and passed. Even persons that did not have any known chronic illness did pass from COVID-19. So it's a serious illness. So I just hope this talk today would have heard someone that had the experience with COVID, and actually for our future references, other respiratory illnesses are still going around, even though it's probably not at a pandemic level, but you should still take the necessary precaution to wear your mask, wear possibly in crowded places, social distances, and always seek medical attention if you have any respiratory illness such as shortness of breath, cough, generalized weakness, etc. Alright? And so any final word for the viewers?
Yeah, like
about health in general and COVID,
right. Experience, when they go to the doctor, they must not put them one side. You have to make family member meet them. But they keep them stronger. But when they put them one side, there's a lot of people, they fret and worry about it and pass away.
Viewers, remember to share, like, subscribe, and leave a comment on this video. And as I said before, it's a medical channel, and it is just for information purposes, not to stay at home and to diagnose yourself. Alright, and remember that we're still living in a time where we have a lot of illnesses going around, so it's always good to get at least your health check once a year and actually be informed and be in the know about different illnesses that can affect us from day to day. Until next time, stay tuned.
Be sure to subscribe for more informative contents on life, sickness, and death.